Have you got sharp pain on the bottom of your foot in front of the heel area? And is it worse after inactivity or first thing in the morning? If so, there is a solid chance that it is plantar fasciitis. Plantar fasciitis is one of the more common causes of heel pain. It occurs when the plantar fascia, a big fibrous sheath along the bottom of your foot, becomes irritated and inflamed due to repetitive use or inadequate use. People often describe plantar fasciitis as a sharp stabbing pain on the bottom of their foot, or commonly in front of the heel. They often describe it as well as being worse when they first get out of bed or after sitting for a while and they go to stand, it'll be worse then. So what are the causes of plantar fasciitis? So overuse or long periods of standing. This is a huge one. If your body isn't ready for it, it can cause inflammation and too much stress and strain on this fibrous sheath, and that can lead to plantar fasciitis. Wearing footwear that doesn't support your natural arch and may flatten it out a little bit more. Untrained running on harder surfaces is a big one I see in clinic. A huge one, and people often don't understand this, is the tight calf muscles. So because there is a fascial connection all the way through to the bottom of your foot, if your Achilles or your calf are tight, this can actually cause or make you more susceptible to having plantar fasciitis. Excess body weight and age can be a big one. We often see this a lot more commonly in the ages between 40 and 60. So when we talk about plantar fasciitis, there are different stages, and three main different stages we are concerned about. Stage 1 is the acute stage. This is where there's that sharp pain, it's worse out of bed, it's very angry, very irritated. Stage 2 is chronic irritation, and this was when it actually lasts for a while. So if you don't do anything originally with the acute stage, this can lead to chronic, where you can start to get even like bone spurs, thickening of the fascia that runs through this area, and the pain will often start to last throughout the day. The third stage is chronic degeneration, and this can be a long-term degeneration of the fascia fibers. So if you want to know how to self-test yourself at home and whether this may be plantar fasciitis, the easy one is to sit cross-legged on a chair with your big toe or your great toe. We simply just pull this back. So have your foot in dorsiflexion, which is dorsiflexion this way, and all we're doing is pulling that toe back into extension. This will often cause pain going down to the front edge of this heel where the plantar fascia, a lot of the fibers attach in there. We're going to get into some exercises now that are aimed to, number one, reduce the tension through the plantar fascia, and number two, strengthen the whole foot so the biomechanics of the foot work a lot better and there's less tension going through the plantar fascia. And this will hopefully return you into sport or whatever else you want to get back into going into the future. So let's get into it, guys. Number one technique is aimed to reduce the tension through the plantar fascia. It may be a little painful to get into originally. We have three options that have three different intensities. Number one, the tennis ball, the least intensity and the less pressure through that plantar fascia. Number two, a lacrosse ball, a little bit more pressure. Number three is a golf ball, and is sometimes a little bit too much pressure. So if you're doing the golf ball and it's way too tender, throw this one away, get a lacrosse ball or a tennis ball, and that'll do the job for you. So I'm going to use the lacrosse ball today. All we're doing here, you can be sitting at home. We are trying to get this ball along the front edge of the heel, so right on the front edge, and try and roll it towards the base of the big toe. So very slowly we're going to work along here to start off with. So placing the ball on the ground, giving over pressure. Maybe you may even want to sort of use your hand to stabilize your leg a little bit, but we're really slowly, you can see how slow I'm going. It's taking me about 4 or 5 seconds to get all the way to the base of the toe, and then slowly rolling back to that inside front edge of the heel. Now we're going to go through 10 repetitions here, guys. So 10 repetitions of back and forth. And after those 10 repetitions, we should feel that the pain may have subsided a little bit. Now, once we've done that, we're going to sit that ball on the front edge of the heel. So the heel's here, that's the front edge. We come right medially to a little bit more to the inside, and we're going to really try and get a solid amount of force. So almost like you're leaning to get off your chair, get that force into it as long as this isn't too painful. And we're going to use that breath, so we're not moving the ball on this one. We're just getting that pressure on, finding that trigger point, trying to get it to release. And we're gonna hold this for 30 to 40 seconds. So try and use your breath, and then normally if the pain starts at like an 8 out of 10, within 20 or maybe 30 seconds, we should be able to halve that pain. So everyone's different, and if you're really in a solid acute stage, this might be a little bit too much for you. So obviously if it's out of your pain threshold, we might need to back off a little bit. But a really good one here to release it. So after that 30, 40 seconds, you can come out and we'll go in to the next one. Okay guys, so this next one is a great hack for you guys to try at home. I'm gonna leave a link to the description here. This is a little fascial blade. They work wonders. Some basic anti-inflammatory cream. I like using Physio cream. It's pretty natural, hasn't got a bunch of bad stuff in it, and it has anti-inflammatory properties. Now from here, all we are doing, a little bit of cream. We're gonna pop that cream on the front edge of the heel, just like that. And then with this fascial blade, it's easier to do this on the ground or sitting on a chair, so we can just rest this leg into a little bit of external rotation. And then from here, all we're doing is working through that plantar fascia and pulling the toes back towards the shin. So slowly rolling the toes all the way up, slowly bringing it all the way back towards the shin. So if you're sitting at home, this often works as well to do it cross-legged, but we're just keeping, and this is pretty light, we're not sort of digging in too hard, but lightly working through the front edge of the heel, pulling those toes all the way back towards the shin, and then slowly back from here. Now we're gonna do 30 repetitions of this. We're gonna start the first 10 to 15 reps pretty close to the front edge of this heel. Now after that, we're gonna slowly start to go up towards the base of the big toe, which is where that plantar fascia, most of the fibers sort of run up that way and attach into. But the whole time, we're sort of scrunching this foot into flexion and then really trying to open it up as much as possible. And you can add a little bit more pressure in, but this one isn't designed to be like the previous one where we're direct pressure down into the deep tissue. We're just hitting and trying to break up and really get the blood flow into some of those superficial plantar fascia fibers. Okay guys, so while we're in this position here, we're going to do a little warm up for the next ones we're about to get into, which can sometimes be a little bit aggressive. So if you're doing this one, this is enough for you, stick to this, skip the next step. But yeah, we'll see how you go. All right, so all we're doing here, resting your heel on a table, pulling the ankle all the way back, as far back into dorsiflexion as it will allow, grabbing the base of the big toe mainly, but also the other toes, cradle the hands and pull it back. So as you breathe out, we're pulling it into a stretch. And as we breathe in, you can release it, relax it for a second. So letting it stretch yourself, as much dorsiflexion, really focusing on that big toe extension and using that out breath. So your exhale to relax and release into the stretch. So I'll do one so you can kind of see, but we're doing 12 repetitions here, guys, pulling all the way back, using both hands so you can get a fair bit of force through here. And then as you breathe out, relaxing, letting it have a little rest. So a really good one here, guys. The next one we're going to be doing standing, getting a lot more force through here, and we're actually going to be using a towel to prop under our big toes, which will stretch the plantar fascia a lot. Okay guys, so for this next one, we're going to roll up a towel. This is going to act as a little prop for that big toe to go into, so we get more of a stretch through the plantar fascia. So we want the base of the toes to be almost off the towel and just the big toes to be propping up onto the towel. So as you can see here, my toes are starting to go into a little bit of extension. Now, once we're into position here, we want a wall or a table or something in front of us. I've got one beside me here that we can hold onto for a little bit of stability. Now from here, we can keep this knee nice and bent, and what we're going to do is try and get that knee as far over the towel as possible. While we're doing this, we are driving that heel, so this right heel into the ground. So we're not lifting that heel off the ground because that defeats the purpose of this exercise. So So driving the heel over, feel that stretch, make sure those toes stay in extension. And then after 10 seconds, slowly rocking back, and then we can go back into it. So make sure there isn't any pain. Make sure if you want to make this more aggressive, prop your toes up more, get them in more extension. But this is a great one to stretch and release some of those fibers that may be causing that inflammatory response when you do a lot of walking or standing throughout the day. So we want to release those. And after 10 seconds, slowly back from here. We are doing 6 reps in total here, guys. So go at your own pace. Try and sink deeper into that stretch using your breath. And this is a really, really good one. So make sure you do the previous steps before doing this one, because this one alone can sometimes be too aggressive, getting straight into it first thing in the morning. Okay guys, so for this next one, I normally get my patients to be doing this holding onto a wall. You can do it holding onto a table as well. If it is my right side, we're going to be stepping the left leg in front, and we're going to try and holding onto that wall, or if you've got a table in front of you, try and kick that leg straight, let this turn into a stretch of the calf. So we can start to bend that knee over the toes. Now what we're trying to do here, and I'm almost starting to lift the inside border of my heel. So the medial side of the heel needs to stay grounded. So we're pushing all our weight down into that inside border of the affected heel. We are sinking the toes as far over as possible, trying to keep this knee quite straight. So unlike the last one where we were bent the whole time, we can start to bend it as we get better, but to start off with, we want this leg nice and straight and really just focusing on bringing that heel into the ground. So we're gonna go just for 40 seconds holding this one, guys. So just one round. And then for the second round, so after you've done the first round with the 40 seconds, the second we're gonna bend the knee and then really drive that inside border of the heel in, and we can bend that knee, and that'll be a little bit more aggressive, but make sure everything stays grounded there, and we're holding this for 40 seconds as well. After the 40 seconds, slowly come out, just move your ankles around. It might feel like you've done a pretty aggressive stretch there. Your ankle might feel a little jammed, but that's another great one to get into. All right, guys, and for this last one, what we actually need is a hand towel. So with the affected foot on the towel, what we're trying to do here, keeping the heel grounded into obviously pressing down to the ground, we're gonna try and scrunch those toes and pull that towel all the way in. So it's a little bit of foot control using those toes. And you can see this can take a second, and some people are going to be a lot more uncoordinated than others. So you might even have a good laugh at yourself after doing this the first few times. But there we go. My foot's starting to fire better. Struggled off the start, but we're going to try and pull it all the way in. We're going to do 5 towels, if that makes sense. So you'll see in a second. So once we get all the way to that last little border, bring it in, and there we go. Once again, roll the towel out. Start with the toes right at the other end of the towel, and then we're doing 5 of these. So that was 1, this is our second, we're doing 5 in total. And you'll see that as you go through this, it's gonna get better. The strength, the muscles in the bottom of the foot are gonna start to fire a lot better, and that's what we want. So when you function throughout your day, you're walking around a lot, you're standing a lot, all these stabilizer muscles in the foot need to be firing. And if they don't, it often puts way too much force through that plantar fascia, which is why we can get that inflammatory response. So by doing 5 of these, we're getting their foot muscles, number one, strengthening, but we're firing them and prepping them for the day ahead. So hopefully we don't get more inflammatory responses. That is it for today. Make sure you add this to your daily routine. So remember, with all exercises, guys, you are better doing a little bit a day than one giant big session a week. Consistency is the key. If you have a friend that may be complaining of plantar fascia pain, feel free to send this to them. It may help them as well. So that's what these videos are here to do, guys, to try and help as many of you as possible to get back to the things you enjoy doing the most. So remember that we have videos dropping every Monday at 7 a.m. Make sure you tune in, watch and learn there's some great ones around the corner. So take care guys, and we'll see you next time.